Up to 40% of people will experience sciatica at some point. But here's the real problem. Most of them never figure out what is actually causing it. They spend months, even years, trying different treatments, spending money on scans, taking pain meds, or even considering surgery when their pain might not be coming from a herniated disc at all. So how do you know if your numbness, tingling, or leg pain is actually coming from a lumbar disc herniation? I've worked with thousands of patients struggling with sciatica and lower back pain, and today I'm going to show you 3 clear signs that your symptoms may be caused by a herniated disc, plus a simple self-screening test you can do at home to get some answers. And make sure you stay until the end, because I'll also tell you 3 key signs that mean you need to seek professional help. Missing this could be the reason your pain turns chronic or gets even worse over time. Let's dive in. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. I've been helping patients overcome chronic lower back pain, sciatica, and neck pain, all without medication, using specific chiropractic corrective techniques. If you're busy with work or home life and dealing with a chronic spinal condition, this channel is dedicated to helping you. Here you'll find exercises, expert tips, and proven strategies aimed at managing and preventing back and neck pain so you can stay active and pain-free. Before I dive in, to subscribe to my channel if you want more tips and strategies to help you achieve lasting relief, improve your mobility, and regain control of your life, all without relying on medications or surgery. I'm going to tell you the first sign in a moment, but first it's important to know that not all leg pain, numbness, and tingling is caused by a herniated disc. Other conditions like piriformis syndrome, sacroiliac joint dysfunction, or even peripheral neuropathy can create similar symptoms. The key difference? A herniated disc affects the nerves coming from your spine, which can create specific patterns of pain and weakness in your leg. So as we go through these signs, pay close attention to whether they match what you're feeling, because that can give you a much clearer idea of whether your symptoms are disc-related or they're coming from something else. So, how do you know if your leg pain, numbness, or tingling is actually coming from a herniated disc? Let's start with one of the most telling signs, how your pain reacts to sitting or bending forward. Sign number 1, pain is worse when sitting or bending over. If you notice that your pain gets worse when you sit for long periods or when you bend over, that could be a strong indicator of a disc problem. Here's why. When you sit or you bend forward, your spine flexes, which increases pressure on the disc in your lower back. If you already have a bulging or a herniated disc, that extra pressure can push it further out, irritating the nerves and causing that pain that radiates down your leg. Think about it. Have you ever sat in a chair for a while and felt that deep ache in your lower back or shooting pain down your leg? But then once you stand up and move around, the pain begins to ease up? That's a common pattern with disc-related pain. Now, if your pain actually feels better when sitting or bending forward, your issue might not be a disc problem. It could be something like spinal stenosis or muscular tension. Next, let's talk about a key movement that can actually relieve disc-related pain. And it might surprise you. Sign number 2, symptoms that improve with spinal extension. Now, this might sound counterintuitive, but if you feel relief when you stand up, walk, or gently arch your back, that's another big clue that your pain could be from a disc issue. Here's why. Extending your spine, like standing tall or lying on your stomach, or even doing a slight back bend, reduces pressure on the discs. This can help take pressure off the irritated nerve and ease your pain. In fact, there's a reason many people with herniated discs say that lying on the floor feels better than slouching on the couch, because extension naturally takes pressure off of the nerves. Now, if the opposite is true, if bending backwards makes your pain worse, you could be dealing with a facet joint issue or spinal stenosis instead. All right, let's move on to the third major sign of a disc problem, which is something people often overlook, but it's one of the clearest indicators. Sign number 3, pain gets worse when coughing, sneezing, or straining. Have you ever sneezed, coughed, or even taken a deep breath and felt a sharp shooting pain in your back or leg? If so, that's a major red flag that your pain could be coming from a herniated disc. Here's what's happening. Every time you cough, sneeze, or strain, like when lifting something or even going to the restroom, you increase pressure inside your spine. If you have a bulging disc putting pressure on the nerve, that extra pressure can trigger a sudden, sharp pain that shoots down your leg. A lot of people don't realize this, but if you start noticing this pattern, it's a strong indicator of disc and nerve involvement. But how do you confirm if your pain is actually caused by a disc issue? That's where the self-screening test comes in. Let me show you exactly how. So this test is one of the easiest ways to determine if you have nerve irritation that's coming from a disc bulge or a disc herniation. So to perform the test, we're going to lay flat on our back. You can either lay on the floor, on a yoga mat, on a couch, or on your bed. And what we're going to do is we're going to start with both legs flat to the ground, and we're going to slowly raise one leg directly into the air, being sure to keep our knees straight. Now, if you start to feel a sharp shooting pain going down that leg, especially before you reach the 45-degree mark, that's a strong indicator that your pain is coming from a disc bulge or a disc herniation. Now let's break down what these results mean. If you felt pain radiating down your leg, that's a possible sign of a herniated disc putting pressure on a nerve. Now, if you only felt discomfort in your lower back, that could mean you have a muscle strain or a joint-related problem. If there's no pain at all, it's very unlikely that you have a disc issue. Now, this isn't a perfect diagnostic tool, but it's a great first step to better understand your symptoms. If your symptoms match what we've covered, it's important to take them seriously. While some cases can improve with the right stretching and self-care, others may require professional treatment. Knowing when to seek help can make all the difference in preventing long-term nerve damage or chronic pain. However, there are 3 key signs that tell you it's time to seek professional help. Let's talk about that next. If your symptoms are mild and improving, you may be able to manage your pain with stretching, postural corrections, and strengthening exercises. But if you experience any of the following, don't wait. See a doctor right away. Severe, persistent leg pain that doesn't improve. Weakness or numbness in your leg or foot. Or loss of bowel or bladder control. This is a medical emergency. Missing these warning signs can mean your condition worsens over time, leading to chronic pain or even permanent damage. If you've noticed any of these signs and you got a positive result on the self-test, this is a strong indicator that your symptoms could be disc-related. That means it's time to take action and start the right treatment. But most importantly, don't ignore what your body is telling you. We just went over the 3 key signs that your pain could be coming from a herniated disc and gave you a simple test you could do at home. If you found this helpful, let me know in the comments. Did you try the test? What were your results? And if you want more in-depth strategies for relieving pain and improving your mobility, make sure to subscribe because I'll be covering exactly that in upcoming videos. The sooner you understand what's causing your pain, the sooner you can take the right steps. If this video helped, be sure to like and share it so more people can get the answers that they need. Now, if you're looking for easy exercises to start relieving back and leg pain from a lumbar disc bulge, I've got you covered. Go watch this video next, where I walk you through easy movements that can help you start feeling better now. Go watch it now.